So in chapter 4, we will discuss tissues, glands, and membranes. This is an overview of today's lecture, where we'll discuss a little bit about tissue origins. We'll describe the epithelial tissue. We'll discuss connective tissue, muscle tissue, nervous tissue. We'll look into what membranes are. We'll look over the theory of tumors, and we'll discuss pretty much like in every lecture that we'll have from now on about aging. Those are the learning objectives for this lecture. And now let's look into how we discuss and how we describe tissues. And the science, the study of tissues is known as histology. And usually the tissues are those groups of cells that are similar in structure, and they are arranged in a characteristic pattern and specialized to perform a specific task. Now, there are a large variety of tissues in our body. However, when we are really looking into this, we can condense them and characterize them as a few groups. And those groups will be epithelial, connective, muscle, and nervous system. And we'll discuss each of them on its own with their own characteristics. So if you're looking into the epithelial tissue, this is the tissue that usually forms a barrier separating the internal body environment, which, if you remember, we discussed before, has what is called a homeostasis. It's relatively constant. The epithelium is that barrier that separates the internal environment from the external environment. So the epithelial tissue will be the tissue forming the membranes and layering the ducts, will line body cavities and hollow organs. And in addition to that, will be part of some specialized structures that are called glands. And we'll discuss that a little bit later. In terms of characteristics, epithelial tissue has an interesting ability of quickly repairing itself when it's injured. And usually will show up in those areas that are subject to normal wear and tear, such as skin. We'll find this inside the mouth, will line the digestive tract, and will have a relatively high rate of replacing dead or damaged cells from what is called an epithelial stem cells. Now, if we're looking in terms of classification, you see in the slide that we can classify them in three main categories. And along with those three main categories, based on the number of layers that the epithelial tissue has, we can have them as one single layer, and this will be called as a simple epithelial tissue, or we may have them multi-layered in more than one layer, and that will be called stratified tissue. Now, for classification purposes, when we are looking at the structure of the cells, we classify epithelial tissue as squamous, and those are those flat and irregular cells. Another type will be the cuboidal, that has this kind of a cube shape, and in section it looks like a square. And columnar, that they are long and narrow. Now, if you're looking into this structure over here, it may seem like we have more than one layer of cells. However, it's just one layer, and it's interesting because that perception of multi-layer is given by the fact that the nuclei of those cells are not positioned at the same level. And by positioning the nuclei at different levels, it gives us the impression that may have more than one layer. However, this is just one single layer of cells, and because of this, it's called pseudo. Pseudo means false, pseudo-stratified columnar tissue. A very specific type of tissue that shows up in some structures of our body. It's called a transitional type of tissue, and if you see they have different sizes of cells and they're disposed in different ways. And this special type of tissue is its ability is to expand when that specific cavity fills in. And we find this type of tissue in the bladder and in the stomach, which are sac-like cavities that need to expand and contract depending on the amount of fluids that will be found inside. So just to summarize, we have the squamous type of simple epithelium. And one characteristic of the simple epithelium is that will be present in those areas that will allow passage or exchange of material from one system to another. Let's say at the level of the alveoli or at the level of the capillary walls, where the exchanges of gases and the nutrients happen and the waste products from the cell will be eliminated. Those will be the areas that you will find the simple epithelium. You have just one single cell layer that allows those materials to pass freely. So we have the squamous type that has those flat irregular cells in capillary walls and in lung alveoli, sometimes found in some areas of the kidney capsule and in serous membranes. The cuboidal one, the square cells, will be found in kidney, liver, and some of the glands, especially in their ducts. Columnar, with the long narrow cells, will be found in the stomach and in the digestive system linings in oviducts. And pseudostratified, I was telling you that is lining the respiratory passages for the simple type, and you will see that how in the stratified is found in different in another type of tissue. So look at this image for a second, and I want you to observe this layer of cells over here. This is the epithelial layer of cells, what you see under, and you can see that there are different types of cells. It may seem that the nuclei are the same, but they are not. Those are actually muscle cells. The epithelial layer that lines up the structure is only here, and it's one layer. The same situation in here, and you can see this is a blood cell, and this is in the pancreatic duct. Here you can see them in the oviducts, and you have the columnar ones. You can see it's one single layer, and under it you can see the structure is actually muscle. Now for the stratified epithelium, we'll have the squamous one that will line those structures that need to provide protection. That's why, and they're subject to wear and tear, and that's why you need more than one layer. Because if you have a tissue that needs to protect an area that is formed just by one layer, one layer of cells, once one of those cells is injured, the protection is inexistent pretty much. So we can find the squamous cells in the outer layer of the skin, lining the mouth, the throat, the anus, and the vagina. We have the cuboidal one that is less common. I'm talking about the stratified type, but still can be found in some glands. We have the columnar in larynx and some ducts, and we have the transitional one. I was telling you about the type of tissue that has this capability of expanding and enlarging and kind of sliding one layer over the other while an organ is changing its shape, and this is lining the urinary bladder. So you can see here, this is actually the mucosa of the vagina, and you can see how many layers actually, in fact, has the mucosa. You can see here the germinal layer, the stem cells that are they have big nuclei, and that's a sign of cells that are highly reproducing themselves and dividing themselves. And you see how the young cells are positioned here in several layers, and how they become, as they become old cells, they are losing their nuclei, the nuclei are disappearing, and those cells will slough out because they are old cells and they actually die. Another type of cell that we can find in as part of the epithelial tissues is a special type of cell that is called the goblet cell. And the goblet cell has the capability of secreting mucus and will be found in those areas that are exposed to pathogens. And mucus, it has a great capability of engulfing a bacteria or dust or any kind of particles that can injure our body and isolate it out from the system. So we have a lot of goblet cells in the epithelial mucosa of the digestive system, and also in some cells, not only we don't have just the goblet cell, those cells have also, in addition, the cilia. And if you remember, the cilia are those tiny hair-like projections that will move away any type of particle that can injure our organism. And those will be mainly found, the cilia, and this type of epithelium will be found in the respiratory system. Now let's look into the glands. And the glands are structures that histological, they are related to the epithelial tissue. However, they have the ability of producing substances. Those cells will secrete different types of products, and those products are sent to other parts of the body. So when we are looking at those glands, we have two types of glands. We have those glands that are called exocrine, and they're called exocrine. Exo means outside, because their secretions, the substances that they produce, will be delivered to another region using a duct. They are removed far away from the area where they are produced. And as an example, we have the sweat glands, the salivary glands, the pancreatic gland. So all those cells, all those cells may produce also a mucus. And in those glands that are producing mucus, we have a lot of goblet cells. As opposed to the exocrine, exo meaning outside, we have the endocrine glands, and endo means inside. Those glands will secrete their products into the extracellular fluid close to the cell that produced it. They are actually removing their products of secretion inside the circulatory system directly. And this is the way to deliver hormones and all kind of other substances that the body needs. And an example of that would be all the endocrine glands in our body, and the pancreas. With pancreas is an odd bird here among glands, because pancreas shows the histological structure of both an exocrine gland and an endocrine gland. Will behave as an endocrine gland in some parts of it, and will have exocrine cells that will secrete the pancreatic juices that will be transported through a pancreatic duct inside the digestive system and will contribute in the process of digestion. So now here comes the first question. And the question is, when you are studying a slide in anatomy lab, you see several layers of tile-shaped cells. What tissue is most likely on this slide? And the options are simple columnar epithelium, stratified columnar epithelium, simple squamous epithelium, or stratified squamous epithelium. The answer is that the tissue that has several layers of tile-shaped cells is a stratified squamous epithelium. And the keywords for that in your STEM questions will be several layers. If it's several layers, it cannot be simple, and it can be only stratified. So the only options that are available will be the option B and D. And the second keyword will be, or words, will be tile-shaped. So tile-shaped means a flat cell. Then that needs to ring a bell for squamous, because columnar, the option B shows columnar. Columnar, we know that is a long cell, tall and long. So the correct answer will be stratified squamous epithelium. Question number 2. Which is an example of an endocrine gland? And the options are glands that secrete hydrochloric acid into the stomach, pancreas secretes insulin, which regulates blood sugar, respiratory epithelium secretes mucus on its surface, and salivary glands secrete enzymes into the mouth. The correct answer for which is an example of an endocrine gland will be pancreas that secretes insulin, which regulates blood sugar. All the rest of those options, the rest of those three options, will give you hints on glands that will secrete their product, will distribute their product away from where it is produced. It's either into the stomach, into the mouth, on its surface. So all those examples will be examples of exocrine glands. Now we are moving into a second type of cell of tissue, and this is the connective tissue. Connective tissue represents that supporting fabric that we will find it in our body everywhere. It's widely distributed, is extensive, and it's kind of blending with other tissue, and it's taking the place wherever we don't have any other type of tissue, or when we are removing an organ, that area will be filled in soon in our body by some type of connective tissue. Now, one characteristic of the connective tissue is the fact that when we are examining it, will contain large amounts of a non-living material that will be seen in between the cells of the connective tissue, and this is called the matrix. And this matrix will be made out of water, protein fibers, and hard minerals in different quantities, and you will see how that actually will relate to different types of connective tissue. Now next, let's look a little bit into a few types of connective tissue. And the first one that I would like you to pay attention to is the circulating connective tissue. And when I'm saying that, I'm actually talking about the blood. So please remember, blood is considered a tissue. And among other tissues, it belongs to the category of connecting tissue, connective tissue. This may be a question not only in one of your anatomy AP classes, but also it may come up in your NCLEX. They really like to go back sometimes to anatomy and ask this kind of questions, and a lot of people tend to forget that blood can be, it's considered a tissue. And the main function of the blood is to carry nutrients, gases, and waste products, along with other material throughout the body. So inside the circulating connective tissue, mainly we are talking about the blood, but associated to it, we have the lymph. So the blood is made out of a certain amount of cells that will be distributed in a fluid matrix, and the blood circulates in between the heart and the blood vessels, while the lymph will have only very few particles that can be defined of cells, and most of it will be fluid derived from a blood plasma and will circulate inside lymphatic vessels. So a second type of connective tissue will be the loose connective tissue, and in this, one of the characteristics of the loose one, and the main kind of gives up the structure of this tissue, will be a soft matrix. So the main purpose for the loose connective tissue will be to provide support and protection. And it can be found in two variations. One will be what is called areolar type of connective tissue, and this areolar type of tissue will be a mixture of loose fibers in a semi-liquid matrix with cells here and there in this matrix, and it's very abundant throughout the body. Most of the tissues that surrounds the organs in our body and fill cavities will be areolar type of tissue. It can be found around organs and vessels, in membranes, and under the skin, immediately after the skin. Another type of loose connective tissue is the adipose tissue that is composed of cells that are modified to store fat. And the main role of the adipose tissue is to insulate the body and to store nutrients as an energy supply that can be used when needed. Adipose tissue is found under the skin and will usually pad around organs and joints. One interesting fact about the adipose tissue is the fact that we are born with a very well-defined number of adipose cells. those cells do not have a high ability to divide themselves. Only a few of them will do that throughout their life. What they do, they have the ability to blow up, to accumulate fat and store more and more and more fat and become bigger and bigger like bubbles. And based on this knowledge, we develop techniques of performing liposuction. And when liposuction is done well, in good conditions, and is removing completely those cells, that the patient, after that, even if they are eating more, they will not going to have a way to store the fat. So in those areas, they will not going to gain fat again. They may gain in other areas where the fat was not removed, but not, let's say, on the abdomen, if we want to correct that area of the body. Now let's look a little bit into and analyze this image. So we are shown here 3 types of tissue, and we can see over here, this is the circulating tissue. You can see the red blood cells and platelets and white blood cells, and you can see that actually there are no fibers over there. There is no structure to hold on. It's a fluid type of tissue. As opposed to that, we have the areolar type of connective tissue that will have fibers, and there is a fluid matrix over there that offers some kind of support. And the one that is probably even denser than that is what is called the adipose tissue, where those fatty cells will pad organs. The next type of connective tissue is the dense connective tissue. We described the loose one, now we are describing the dense one. So the dense one, as opposed to the loose one, will have a firmer matrix that has a bigger number of collagen and elastic fibers. Will still have a certain amount of cells that exist in between those fibers. However, it's a tissue that provides more protection and support. However, this is also flexible and can be used as attachment points. And we have 2 types of, when we analyze the structure of the dense connective tissue, we have a type that is called irregular, where mostly the fibers will be in a random arrangement. And we find that in membranes and in capsules and in all those organs that they do not have a very regular type of structure, and the fibers need to intertwine and kind of place themselves in different directions in order to cover the whole surface. And the second type of dense connective tissue will be the regular one. In this one, pretty much all the collagen and elastin fibers will be aligned in a parallel way, very strict parallel ways. And we can find them in ligaments and tendons, and it makes sense that they will be arranged like that, while ligaments and tendons are part of the muscular system, and they develop under the gravity lines and the force lines that will action on that specific type of muscle. Another type of connective tissue is the cartilage. And the cartilage can be defined as a solid matrix that is both strong and flexible. It will provide protection, it provides structure, has a great way of absorbing shocks, and is very elastic. And inside the connective tissue that is the cartilage, we have 3 different types. Now, before going into the types, I would like to mention that the cells found in the cartilage have a name, and they are called chondrocytes. And the name of the chondrocytes comes from the word chondro, which means cartilage, and cyto means cell. So chondrocytes will be the cartilage cells if we want to really translate the word. So let's see, what types do we have? We have the hyaline type, which is tough and translucent. And we can find those this type of cartilage covering the end of the bones. Will make up the tip of the nose, will connect ribs to the sternum, will reinforce the larynx and the trachea rings. So this is tough and translucent. We have another type that is called the fibrocartilage, which is firm and rigid, and can find them between the vertebrae and in all those joints that they do not allow for a lot of mobility in between the bones, and they need to provide a certain rigid structure. And the third type will be the elastic cartilage. It's just like the name says, has a high amount of elastic fiber, has the ability to stretch and return to original size, just like an elastic band. And we find this in larynx, in epiglottis, and in outer ear. The last type of connective tissue that we will need to describe today is the bone. And in the bone, you see that the connective tissue has a common denominator, has a matrix. And we started with the matrix that is the most fluid, and we'll end up with the one that is the most solid. So the most solid out of all the matrix that we have in connective tissues will be the bone. So it's solid matrix, it's hardened with mineral salts. And the bone, it's obviously makes up the bones of our skeleton and provide support and structure and protection, and along with the muscles will produce the movement. Before I'm moving forward, just to mention, if for the chondrocytes we have if for the cartilage we had the chondrocytes as the cartilage cells, for the bone we'll have the osteocytes, or the bone cell, osteobone cytes cell. We have also in the bone, we have another type of cell that is called an osteoblast. And blast means a young cell. If we really want to describe it, we found the same type of chondroblast in the cartilage. Cartilage may have very young cells that are called also chondroblasts, and they are active in producing the matrix of the cartilage. The same way osteoblasts are active in producing the bone matrix. Once they become old and less active, they become what is called an osteocyte. In addition, in the bones, we have a third type of cell that is called an osteoclast. So osteoclast is a cell that will provide reshaping and remodeling of the bone when needed. So let's look at question number 3. And question number 3 says chondrocytes are to cartilage as osteocytes are to. So the options are bone, fat, muscle, and tendon. The correct answer is bone. If you remember, chondro means cartilage, cytes means cells. So chondrocytes are the cartilage cells, as osteo, bone, cytes, cells are to, obviously, bone. Question number 4. You are studying a slide of a body tissue in anatomy lab, and you see a few similar cells that do not contact each other and many thick collagen fibers oriented in the same direction. What tissue is most likely on the slide? And the options will be areolar connective tissue, dense connective tissue, stratified epithelial tissue, and transitional epithelial tissue. The answer is the tissue with few similar cells that do not contact each other and many thick collagen fibers oriented in the same direction is dense connective tissue. The keywords for that will be oriented in the same direction and many thick collagen fibers. The moment that I see collagen fibers and thick collagen fibers, the epithelial tissue is out of the question, because whenever I see collagen or elastin fibers, that should be a connective tissue. It connects. It has a lot of matrix. Now, I have two options that contain connective tissue. I have option A and B. Option A says areolar, and option B says dense. Now, if I'm looking at that, the question back, and I see many thick, oriented in the same direction, it cannot be areolar because that's a loose connective tissue. That will not going to have the fibers oriented in the same direction, but kind of dispersed everywhere. The next type of tissue that we need to discuss today is the muscle tissue. And the muscle tissue is made out of cells that are called muscle fibers. And the biggest quality of those muscle fibers is the fact that they can stretch and contract and produce movement as a result of that definitely along with tendons and ligaments and bones, but the main movement is produced at the level of the muscle cells. Now we have three types of muscle tissue. First type will be the skeletal muscle, and this is a voluntary muscle. It's under the control of our mind. We can decide when we want to move, when we want to stop. It's totally under our voluntary control. Now, when we look at this type of muscle, we see it looks striated. It looks like having an alternation of like a pattern of dark and light banding that are called striations. And for that reason, this type of muscle is called striated. The second type of muscle, and on purpose I'm jumping to the third one on this slide, is called smooth muscle or visceral muscle, which is totally involuntary, is not striated, and is made out of spin-like type of cells with one nucleus, each of them, as opposed to the muscle tissue that may have more than one nucleus. For the smooth muscle or visceral muscle that is found in all our internal organs, this is totally not under our voluntary control. We cannot tell our stomach to move now or to stop now or to dilate now. They are under a certain control of the nervous system, however, is not controlled by our brain on a conscious level. And the third type looks like a hybrid between those two. And on purpose, I'm talking about it at the end. It's called cardiac muscle. And obviously, cardiac relates to the heart. It can be found in the myocardium. It's also involuntary. It's made out of cells that have one nucleus. They are very similar to the smooth muscle. However, when we are looking at the microscope at the cardiac muscle, it may have an awkward striated structure. And this is because may contain some intercalated discs, some connections between the cells that will may give this impression of striations. Last type of tissue that we need to talk about today is the nervous system. So the nervous tissue is that part that will make up for the body's communication system, is the main controller for all the functions in our body. The nervous system will be found at the level of the brain, inside the nerves, inside the spinal cord, and the nervous system is made up of two types of cells. One is the neuron, and the neuron is the main nervous system cell, and another type will be the neuroglia, which is the support system cell, kind of supporting the main actor in this system. So the neuron represents the basic unit of the nervous system. The neurons are made up of a body of the cell where we can see the nucleus. At the level of the body of the cell, we have a multitude of projections that are called dendrites. Through those dendrites, the impulses, the nerve information will come towards the neuron and will be projected outside, will be transmitted out through one single projection. Every single neuron will have many dendrites, may have many dendrites. Some will have only one or two, but most of them will have more than two. However, they have only one projection outside, only one axon. So the axons usually are making up the nerve bundles, the nerves, and on the axons you will see those Schwann cells that will form the myelin sheath that will allow for the nerve impulse transmission. I was telling you about the second type of cell that we can find in the nervous system, and that's the neuroglial type of cells. And neuroglia will support and protect the nervous system. There are many types. There are more than one type of cells. Their main function is to support the main actor, the neuron. If you see here, we have the astrocytes that are pretty much the intermediate, the middleman in between the neurons and the capillaries. There is a concept in the nervous system that is called the blood-brain barrier, and that barrier is made out of astrocytes. because the neurons are so important in terms of function for everything that happens in our body at every single level, they need to be protected. And while in our capillaries a lot of toxins or harmful substances and germs can find their way in, the astrocytes are the middlemen that will recognize those substances that are harmful from those that can be nutrients and may be transmitted to the neurons. We also have other cells like microglial cells or oligodendrocytes that will remove foreign organisms that can be around the neurons or cellular debris. And we have the Schwann cells that will create the myelin sheath, the fatty sheath that surrounds the axons. Neuroglial cells do not participate in nerve impulses transmission. They do not have a nervous system function. However, when a neuron dies, neuroglial cells will take the place of that neuron. One interesting thing about the nervous system is that we are born with a tremendous amount of neurons. We are not using all of them, and we can afford, in a way, we can say that we can afford to lose some of them. However, important to remember is that neurons do not divide. Once a neuron is damaged, will completely die, and no other neuron can divide and take its place. You can see here how the nervous system can be found at the level of the brain, with what you see here in a lighter color is called the white matter on the outside of the brain, and is made out of the axons that are covered in fatty myelin sheath. That's why the color is lighter. And inside, you see the grayish type of color, the darker color inside. It's called the gray matter, where all the bodies of the neurons sit, and the nuclei are over there too. That's why the color is darker. You can see in image B, you can see bundles of neurons with connective tissue along them. And here is a detail of body of a neuron. So let's look at question number 5. Which tissue is striated and under involuntary control? And we have areolar connective tissue, cardiac muscle tissue, skeletal muscle tissue, and smooth muscle tissue. The correct answer will be the tissue that is striated and under involuntary control will be your cardiac muscle tissue. And if you remember, I was telling you that skeletal is striated and voluntary, smooth is not striated at all and involuntary, yet cardiac, though sharing some qualities in some aspects, histologically speaking, with the smooth muscle tissue, when we are looking at the microscope at the cardiac muscle tissue, it may seem striated because of the intercalated discs. Something else that we need to discuss today are the membranes. So membranes represent those thin sheets of tissue, and they have many properties. Some may be very fragile, some may be tough, some may be transparent, others may be opaque. One thing they have in common, they usually cover a surface, or they may divide partitions in our body. They may line a hollow organ or body cavity, or may work as an anchor for an organ. Those type of tissues may contain cells that have the capability of secreting lubricants. That their main purpose for that is to provide a better movement of organs against each other. So we have two main categories of membranes. We have what is called the epithelial membranes, and we have the connective tissue membranes. So the first type will be the epithelial membrane, and the name epithelial comes because the superficial layer of those membranes will be made out of a layer of cells that are epithelial layer cells. So we have a few types of epithelial membranes. One of them will be the serous membranes that will line body cavities and cover internal organs. We have a different type, another type that is called mucous membranes, and they will line tubes and ducts that open to outside of the body. And if you remember, I was telling you that some of the epithelial cells have the capability of secreting mucus. So in mucous membranes, we have a bigger quantity of the mucus secreting cells from the epithelial layer that are the goblet cells. And also, we have a membrane that is called cutaneous membrane that usually we are calling that the skin or the integumentary system. Now, one type of epithelial membranes will be the serous membranes, and those are lining the closed ventral body cavities. One quality of them is that they will not going to connect in any way with the outside of the body. They usually will secrete a very thin and watery lubricant layer, a little layer of fluid that is known as serous fluid, that will allow the organs that are usually in movement, like heart or lungs, that they are in continuous movement, they expand and contract, to move with minimum of friction. Now, this thin epithelium of serous membranes will be called mesothelium and is overlying usually areolar tissue. And the membrane itself, it's called the serosa. And we have three serous membranes. One of them is called pleura. It's made up of two layers. We have one layer that will line the thoracic cavity from the inside and is called parietal. And we have one that will cover the lungs, will cover the organ itself. And because of that, it's called visceral. Everything that relates to an organ of our body will be called visceral. A second type of serous membranes will be the serous pericardium. The parietal layer will line the pericardial sac, while the visceral layer, just like in the case of the lungs with the pleura, the visceral layer will cover the heart. And the third one will be peritoneum, with the parietal layer lining the abdominal cavity and the visceral layer covering all the other abdominal organs that are considered intraperitoneal organs. So you can see how those, in this picture, you can see how we have two layers, and this is a detail with the visceral one closely attached to the organ, and the parietal one lining the cavity. And it's the same thing we can see where the pleura is, allowing for a small cavity in between those two layers where the serous fluid can be found. Another type of membrane will be the mucous membrane. And again, it's named like that because it contains a high quantity of goblet cells that will produce the mucus. So where do we find this kind of membranes? Well, we'll find them mainly in lining the digestive, respiratory, urinary, reproductive system. And what's interesting about them is that as opposed to the serous membranes that were not connected to the outside of the body, the mucous membranes are connected to the outside of the body. And that's the main difference between them. While the mucous membranes can be found in the large variety of types, what they have in common, they have what is called an underlying layer of areolar tissue known as lamina propria. And you'll see how that will become important at a certain point when we'll discuss development of cancer and how this layer of the basal membrane or the lamina propria can or may not be invaded by cancer. So those mucous membranes will have different associated structures, cellular structures like cilia that will trap and remove foreign particles along with the mucus, will protect deeper tissue, and will have the ability to absorb food materials in the digestive system. Connective tissue membranes will consist mainly of connective tissue with no epithelium. So one type of connective tissue membrane will be what is called a synovial membrane, and those will line joint cavities and will secrete what is called synovial fluid that will lubricate the joint and will allow for the movement of the bones against each other, especially in those high movement type of joints like the knees or the hip or the humerus, allowing for the bones to move against each other without friction. We'll also line some small cushion sacs that will be placed around the joints, and those are called bursa. Meninges is the cover for the brain and the spinal cord. We have the fascia that is made out of fibrous bands or sheets that their main purpose is to support organs and hold them in place. And we have two types of fascia. We have the superficial one that it can be found underneath the skin, where has the main function of insulating the body. And we have what is called the deep fascia that covers and separates and protects the skeletal muscle. This is that whenever you're cooking stew and you're buying the meat, will have that pearlish white thick layer that usually you're cleaning out before cooking the meat because it's impossible to chew. It's very, very tough. And that's your deep fascia. And we'll have another connective tissue membranes that will surround organs. We have the fibrous pericardium around the heart, the periosteum that cover the bones, and perichondrium that will surround the cartilages in our body. So for question number 6, the question asks us which membrane contains epithelial tissue? And we have bursa, fascia, meninges, and pleura. The answer for the membrane that contains epithelial tissue will be pleura. If you remember, we have membranes that contain epithelial tissue as the outer layer. We have others that have connective tissue as the outer layer, and others that have none of those. And pleura is the one that has an epithelial tissue. So you will see that tissues and aging is a common denominator when we will discuss our systems throughout this class. In general, when we are looking at tissues and aging, connective tissue usually will lose elasticity. The collagen and the elastin fibers will become less flexible. In addition to that, the amount of water that is found in the matrix of those tissues will decrease with the age increasing. Probably the organ where that is the most obvious will be the skin because it's out there and it's visible. Along with that, we'll have a change at the blood vessel level, will be reduced capacity for blood vessels to dilate and constrict, will become more rigid, or will be destroyed, especially in periphery, and especially when we are talking about capillaries. We'll have a low metabolism in most of those tissues, and that will be reflected in how they look like. Most of the tissues with aging will go through a process that is called atrophy. They will become smaller and more condensed and will lose part of their function that they had before. Now we need to talk a little bit also about tumors and how tumors relate to tissues. So normally the tissue will have cells that will divide themselves. In a normal cycle of a cell, the cell may divide for a couple of times, and at a certain point that cell will become old enough and will go through the process of cell death. Whenever there is an abnormal growth of cells, when there are more cells that are growing in one area, we'll define that as a tumor or a neoplasm. Now we have two categories of tumors or neoplasms. We have those that are considered benign and those that are considered malignant. And there are some differences in between them. And I'm sure that on a very intuitive level, you know those differences, but let's look at them in a more scientific way. The science, or the, in a better way saying, the medical specialty that looks into tumors is called oncology, is the specialty that will treat cancers. Not that much the benign tumors, but mainly the malignant. So let's look a little bit about we'll try to compare and contrast the benign and the malignant tumors. So when we are looking at the cells at the microscope and we are analyzing the cells in the benign and the malignant tumor, those in a benign tumor will resemble normal cells, while those malignant do not even look like the parent tissue that they are coming from. Let's say you are looking at cells that are coming from a skin cancer, they do not look like skin cells. They do not resemble anything, in fact. They become like a monster type of cell. They become themselves. Cells in a benign tumor tend to stick together, and a benign tumor will have what is called a capsule, will have a kind of a fibrotic outside tissue that limits, it provides the border of that tumor. On the other hand, the malignant tumor, the cells have a high capability of breaking away from the originating mass and travel and lodging in to other tissues and creating what is called a metastasis. A benign tumor usually is confined to the tissue of origin, while the malignant tumor, I just told you about that, has this high capability of spreading far away from the original tumor, um, and they usually travel through blood or lymph vessels. In terms of treatment, the benign tumor, if needed, because in some cases the surgical treatment, if it's not a pressure to adjacent structure, usually a surgical treatment is not even needed, or for cosmetic purposes maybe. But with surgical treatment, just by removing the tumor, that ends the process. Nothing else needs to be done. With a malignant tumor, however, the treatments may vary, and it's a wide range of treatments that we can do with a malignant tumor. Most of them starting with surgery. So, what is the damage that a benign tumor can do to our body? So, most of the time, it's a minimal damage, mainly to the nearby tissues. A tumor may grow and may push on other tissues and compress other tissues, but not more than that. However, a malignant tumor can lead to death of the patient, regardless where it started, if it's not treated in time. Benign tumor, another characteristic is their rate of growth, and they grow usually very, very slow, while malignant tumor has a very rapid cycle of growing and spreading. This table will summarize for you a few terms, and let's walk through them really quick. A papilloma is a tumor of the epithelium that it's projecting outside. Will usually have a stem, and as an example, those are the warts. An adenoma is a benign tumor of a gland. Adeno is gland. Lipoma is a benign tumor that originates in the fat tissue. An osteoma is a benign tumor that originates in the bone. A myoma, it's a benign tumor that originates in the muscle. Angioma originates in the blood vessels. A nevus is usually a harmless type of skin tumor, and as an example of that is your regular mole. A meningioma originates in the meninges that lines the brain and the spinal cord, and the chondroma is a tumor that originates in the cartilage of the cells. One common denominator for all those terms is the fact that when I'm naming a benign tumor, that will end with an oma. And I know that I just said that because you will see now how in malignant tumors, I still have two of them that will end also in oma, but they are malignant. And one of them is carcinoma. That usually carcinoma is the general term for any type of epithelial type of tissue origin for a tumor. It can start in the skin, in the lung, in the breast, and usually, because if you remember, it starts in the epithelial tissue, it starts at the lining of those organs. We have sarcoma, which is a tumor of the connective tissue. It can be bone, cartilage, or even muscle. Leukemia is a cancer of the white blood cells, while lymphoma is a tumor of the lymphatic tissues. Glioma is a tumor that starts at the neuroglial type of cells in the nervous system. So when we call cancer, we actually refer to malignant tumors. And regardless of where they start, they may show up and have some common denominators or elements that may increase this suspicion that that lesion can be a tumor, a malignant tumor. It will be a thickening or a lump. It can be a changing color, shape, or size of a mole, a sore that does not heal, a kind of a lesion that never healed properly, unusual bleeding or discharge, difficulty in swallowing, a persistent indigestion or discomfort after eating, hoarseness or persistent cough, a white patch in the mouth, changes in bowel or bladder habits, unexplained weight gain or loss, or feeling weak or very tight. So how do we diagnose the cancer? Well, the pure diagnostic and a diagnosis of a malignant tumor can be formally done only when we have a biopsy, where by looking at that biopsy at the microscope, we define the type of tumor that we are dealing with. However, we have some other tests that can support our suspicion or may raise the suspicion and will increase the awareness for looking to look for a cancer in different areas. We can use the regular X-ray, and your mammography is actually an X-ray of the breast. And you can see here in this picture, this is highly suspicious. This hyperlucent lesion in the breast is highly suspicious for breast cancer. We cannot say it's breast cancer until we'll biopsy it and we'll look at the microscope at it. We have the CT scan, and you have here two examples of how the CT scan looks like, and you can really see the organs in different type of sections. This is a transversal one, and this is a coronal one. We have the ability to use MRIs, while the magnetic resonance imaging is not using X-rays, is using magnetic fields. Other types of imaging that help in the diagnosis will be ultrasound or the PET or positron emission tomography. So, as I was telling you, the pure diagnosis is based on a biopsy and histological analysis. We may have tumor markers that are some type of proteins that are produced only by the cancer cells, and they are very, very typical for different types of cancer. We have those that are typical for prostatic tumors. We have the CA125 that is typical for the ovarian cancer. We have alpha fetoprotein that is typical for the liver cancer, the carcinoembryonic antigen in digestive system cancers and for breast cancer, and so forth. We'll have specific ones. Usually those tumor markers are used for the follow-up of the patient. Whenever those tumor markers are increasing suddenly in a former patient that had some cancer, we need to look for a recurrence of the disease. We also look into genetic profiling of a cancer, and that looks for identifying some specific mutation in a particular tumor. Now, we know that some of the cancer are hereditary, and we are looking into that in order to make aware other family members, especially close family members, to be aware of the possibility of developing one of those cancers at a certain point in their life. Once diagnosed, a cancer will be staged, and the staging not only indicates the severity of the cancer, but also the prognosis of that patient, how good or bad they will do on a long run. What is their survival chance in the next 5 years? And we are using for solid tumors what is called the TNM system. What's the size of the tumor will be the T. What's the involvement of the local lymph nodes will be the N, if they are involved, and how many of those. And M stands for metastasis, if metastases are present or not at the moment of the tumor diagnosis. In terms of treatments, usually cancer will be treated by a multitude of methods. Having at the core of the treatment, probably the most common method will be surgery. In association with surgery, the next two methods of treatment will be radiation and chemotherapy. Some tumors are both radio and chemo sensitive. Some are just radio and some are just chemo. In most of them, nowadays, we are adding what is called biological therapy or immunotherapy that will either increase or decrease the immune response of the body, depending on the type of the cancer and what is the result that we are looking for. We also have hormonal therapy for some types of cancers, especially blocking certain receptors and trying to prevent the recurrence of the disease, as we do in some breast cancer patients. And we have what is called angiogenesis blockers. And just to explain that very, very quick for you, a tumor growth is highly dependable on the amount of vascular supply that the body can provide. Angiogenesis means, it can be translated, angio means blood vessels, genesis means creation. The more blood vessels that tumor can create to itself, more nutrients the tumor will receive and higher it will grow and develop. If I'm providing the body with what is called angiogenesis blockers, that tumor will have a decreased capability of creating new blood vessels, and the development or the progression of the disease can be reduced or even stopped. So question number 7 asks you, what is another term for tumor? And the options are arthritis, bursa, neoplasm, and peritonitis. The answer for what is another term for tumor would be neoplasm. What is the removal of living tissue for microscopic examination called? And the options are biopsy, computed tomography, magnetic resonance imaging, and positron emission tomography. The answer is the removal of living tissue for microscopic examination is called biopsy.